to our video again today. Today we are going to talk about something special. Kindly I want to welcome you to our video today, and we have something very special to talk about today. Kindly I want to appreciate all of us who have subscribed to our channel. I really thank you for subscribing to our channel and also for supporting us in the channel. Our channel is Future Talks. Kindly, if you have not subscribed, I request you to follow the link down below and subscribe, and also leave a nice comment down there, and also like the video, so that is the best way you can support us. So guys, I want to welcome you to our video. Like I always tell you, I am doing this video from Africa. Africa is one of the continents of the world, so that is I'm presenting this from one of the African country called Kenya in East Africa. So today we want to talk about something special, especially regarding our health. I want to talk about the commonly used drugs, the drugs we use here in Africa and also all over the world. There's a special class of drugs called cephalosporins. Cepharosporins. I'm going to write it here so that you can have a check on the same cephalosporins. I don't know how you pronounce it in French, in Italiano, in Spanish, but in English it's called cephalosporins. Actually, cephalosporins, in simple terms, it's called, it is a class of antibiotics which mainly work on bacteria. So it is, this kind of drugs, they were discovered in 1945 during the World War II. That's when the drugs were discovered, especially with the injuries of the soldiers and the casualties who were involved in the war. This was a major drug which was used, and it really helped the people during the World War II at that time. So they came out with the names cephalosporins. Actually, these cephalosporins, since that time of 1945, we've had a lot of changes which has occurred, and mainly because of the development of technology and everything. There is a change which has been done, especially the biochemistry and also the structure of the cephalosporins. So during that time they were called first generation when they were discovered, but now we are doing it currently it is up to the fifth generation, or the later generation of this kind of cephalosporins. So these drugs, they are mainly used in the treatment of urinary tract infections, especially that is where mostly we use it. So example of these cephalosporins, we have what you call cefuroxime. We have what you call the commonly used here in Africa. It is a very common drug, and it's the cheapest antibiotic, as we say here in Africa. It's called ceftriaxone, which is normally given through the intravenous, that is IV, is given intravenously, or it can be given IM or intramuscularly. That means you can be injected through the vein, and also it can be done on the muscle of the buttock, so that with a painkiller, so that it works well with depending on the problem of the person. So especially the urinary tract infection, we use it. If we have what you call otitis media, if you have ear problems, otitis media is very common, especially in kids. So that is a drug of choice for the same. So actually, most of the bacteria strains which we have in the world, they are easily treated by this antibiotic, those classes of cephalosporins, especially ceftriaxone, which is a third generation kind of drug. It is the commonly used, and mostly the side effects are not very many with it. So it is mostly used here in Africa. But what are the side effects of these cephalosporins? The most common, like another drug, we have what you call, somebody can develop nausea, can develop headache, they can develop vomiting, profuse vomiting, and in rare cases, someone can react to the drug. When somebody has reacted, we mean so like somebody's body, even the breathing is affected. So there's some very extreme itching and everything. Somebody can develop that one. So when you go to the hospital and you are administered these cephalosporins, it is advisable for the health worker to monitor the patient as one administers the drugs, especially these direct, which you give direct to the vein, is very is encouraging that someone takes monitors the patient immediately the drug is administered or in the process of administering those drugs. And what is recommended, like especially vomiting or nausea, is a very common kind of side effect which when you are administered IV of ceftriaxone. So it is really encouraged that some doctors prefer that you give with Placil or metoclopramide, or you give it is administered when somebody like 2 hours after eating or 2 hours before eating, so that you don't induce vomiting if somebody has eaten something, so that you don't get that kind of vomiting. So also as a person, when you go for treatment and your doctor tells you or your nurse tells you you're going to get ceftriaxone, it's good to give more information if you have any reaction to that drug from previous experience, because some reactions can be extreme. Like I told you, you may have some breathing problems, you may have extreme body aches, and also you may have reduced kind of urine output. That means your frequency of urine or the urine amount reduces so much. So that's a concern also you raise with your doctor or your nurse over the same, so that the appropriate action is actually taken. But the side effects are very minimal. That is why cephalosporins are very safe to use, especially with even in the case of sexually transmitted diseases like gonorrhea. It's a drug of choice for the same. The dosage is titrated or it's put according to the need of the patient, and it's monitored by the doctor or the nurse so that the patient gets well from the treatment. At a certain level, also it also treats bacterial meningitis, depending on the prescription and also the severity of the same. It works very well in many patients. So this third generation, especially I can talk here in Africa, ceftriaxone is very much used, and it really covers a lot of those bacterial infections which most of the time attack the patients. Even when a patient has been done operation, so these drugs are used as prophylaxis. Prophylaxis means to prevent any new infections on the patient when the patient has undergone surgery. So it is a common practice here in Africa that the patient is put on cephalosporins so that to prevent the patient from developing any kind of infection, and also assist in the healing, the faster healing of the process of the patient. So I really felt it's good we share with you in the simplest. We have a lot of chemistry of this, the mode of action of this cephalosporins. But simply I want to put it because I know most of us we don't who watch this channel are not from the medical field, or they are not from the biochemistry classes. But actually these drugs attacks the bacteria from the wall of it, so that it kills it, or it mimics the how the bacteria behaves, and also so that it can enter the bacteria and also kill it in the process, so that when the bacteria is killed, the patient can get well from that kind of infection. So if you want more details on reading up on the biochemistry of the cephalosporins, I encourage you. There are many sites there, or there are many drug books there you can see, you can look at, especially about the organic chemistry of the cephalosporins. But in simple words, I want to say it attacks the wall of the bacteria. The drug attacks the wall of the bacteria, either to kill the bacteria or to enter the bacteria and also make it inefficient so that the person gets well. So also, as healthcare practitioners, there are things which you should ensure, especially guys, as practitioners, I'm saying that we should also, all the practitioners, that's the nurses, the doctors, all the people who are recommended in your country to administer drugs to you, you should practice safe practices, like ensure you give the drug through the right route, you have the right patient, you know, the right, those the 4 rights, actually 5 rights: the right patient, the right drug, the right route, and also the right that is, we have the right route, we have the right medication, we have the right patient, and also the right drug, so that we get those are called the 4 rights of the patient. Ensure that they are adhered to, so that we ensure safety of the patient. And also, when you administer those drugs, also have the antidotes with you, uh, so that we, here in Africa, most of the time we use hydrocortisone to counter the side effects, so that also be ready in case of extreme kind of reactions, so that the patient is resuscitated properly, so that we make the patient more safe, because some of these extreme reactions can be very serious and also put a patient in a very awkward situation. So we want the patient to be safe, and also our practice to be safe, ensure that all this is done very properly. So I also want to encourage that we ensure that the drugs, all these Cepharosporins, yes, they are drugs, but we should ensure that we make safe use of them. Also, the patient should ensure that they get the right prescription after doing some lab work. Like here in Africa, we have what you call full hemogram, where the blood is checked. If there's a bacterial infection, that's when the person or the patient is commenced on treatment. So it is very essential that the patient is put through a test, is examined very well, so that when the drug is started on the patient, it really helps. Because at the end of the day, we have what we call drug resistance, and we don't want our patients to develop what we call drug resistance. So most of these antibacterial or antibiotics like cephalosporins, which work on bacteria, it's very important that we take caution, because somebody can develop resistance. Resistance means that when you misuse antibiotics, your body cannot when next time you use the drug cannot work very well within your body, and you can't get well healed from that kind of a condition. And we don't want to get to that problem. And if that drug cannot help you, we go to the other class of antibiotics, which are very strong, and also they are very expensive, and at some point they cannot be convenient for the patient at that particular time. So as much as possible, we want to make the better use of these cephalosporins, so that they really assist us when there is need for the same, so that we avoid over-the-counter drugs, where a patient orders the drugs for themselves, injected themselves, and or because of the kind of what I call malpractice, where a patient is not properly screened, especially through the lab. The blood is well investigated to find which kind of bacteria is really causing the problem with the patient, so that the patient is started on proper medication. This can lead to a lot of resistance, and that puts a patient in a very awkward situation, where the result can be very, 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 very serious. So we advocate for safe use of drugs, especially cephalosporins, because yes, they are very helpful, but when misused or not used properly, they can really bring a problem, especially when we have resistance to the antibiotics, which can really put us in a very big problem. I want your health to be well. I want you to be taken care of with these cephalosporins. It was a very great discovery which was made, like I've told you, in 1945, and it can really improve one's health. So we want, as the science and also technology goes to another level, I told you we are on the 5th generation, from the first, second, third, fourth, now on the 5th generation. So those drugs as they get developed to attack particular bacteria, because also bacteria change their behavior and the way they act on, and the way the drug works on them. So the science has also helped us so that the drugs get improved and also work on the current kind of environment we are, or work in the body as it is now, and with the kind of bacteria which we have at the moment. Guys, I want to wish you all the best and also welcome to our next video. Thank you very much.